Okay, welcome back. In this video, I'm going to be talking about my med bag. This is my medical kit that lives in the back of my vehicle. I am a emergency medical technician licensed by the Department of Health of Pennsylvania, and I've been an EMT for six years now. It's fire-based EMS, so don't expect too much. I did run on an ambulance for a little bit, and I have CLS training from the military. But this is my bag that I keep in my car. The only thing that I don't have in here that I would normally have at my job is oxygen and oxygen. That's it, yeah. Okay, so the bag itself I got from Amazon. It's nothing nice. I do like that it has the clamshell that opens up this way. On the outside I have a large carabiner, so that way I can clip this onto something and hang the bag and it opens up. On the side I have some trauma shears, and on the other side a tourniquet. Just some quick, grab it immediately. On the front pouch right here is the good old-fashioned SAM splint. These things are incredibly versatile, and I think it's really important to have. And that's all I got in there. All right, getting into the meat of the bag. Let me just make sure I'm still in the frame, because I've been having issues with that lately. Great. Okay. So, how I have this set up is about as good as I can do for this bag. Down in the main compartment is I have 5 compartments that I've tried to split up as best as I can. So I have bandaging and major bleeding. I have some medications, and then I have airway stuff, and then this is going to be mostly diagnostics. What's nice about these, or about this bag, is these compartments unvelcro. So if you need to say, hey, you doing airway stuff, you can pass off, the airway pouch to it. So that's very nice. And the other thing I really like about this pouch is all the zipper pulls are in red paracord with rubberized, the shrink tubing on it. So you're not like fiddling around trying to find where the zipper is. So very, very nice. I like that. All right, so we'll just start with this compartment right here. I have a SWAT tourniquet, or SWAT T, and then I have varying sizes of Israeli bandages. All right, in this one down here, I'm going to have my compressed gauze. I'm going to have some quick clot, some more compressed gauze, and then gauze rolls of gauze. Lots of gauze rolls, some 4x4s. This is kind of like a larger abdominal absorbent pad, and then some 6x6s, or are these still 4x4s? 4x4s, a bunch of 4x4s. So this is all my gauze. Really, really good for packing wounds, absorbing blood, keeping, securing the splint. You can use that. And of course the compressed gauze are always really nice. Okay, so that is more bleeding control. All right, next we're going to get into my diagnostics pouch. So diagnostics is essentially vitals taking. I have my stethoscope. I have an oral thermometer. I have a pulse oximeter, and what a pulse oximeter does, it's a thing that sits on your finger, and it tells you your heart rate and your blood oxygen saturation. This is a adult blood pressure cuff, just a blood pressure cuff. Then also in here, because I didn't really have any other place to put them, is some burn dressings. So this is the North American dry sterile burn dressing cravat extra large, and then I have some Burn Tech burn dressing as well. So I didn't have any other place to put it, so I just stuck it in there. All right, so that's my diagnostics. Why is it important to have a thermometer? You got to know your patient's temperature, especially if they're going to be hypothermic or hyperthermic. And also, if you're going back to like being a medic for soldiers. I wasn't a medic in the military, but like if you are your team's medic, you need to be able to not only treat them when they're injured, but also treat them when they're sick, right? So, being your team medic doesn't necessarily stop at when the bullets stop flying, right? So you need to be able to take care of your guys no matter what. All right. Next up is going into my airway pouch. So I don't have it. I want to get it. Is that pocket BVM that collapses? A BVM is a bag valve mask. It's a way to provide mechanical ventilation to a patient who is not breathing or having trouble breathing. I don't have that, so all I have is just these CPR pocket masks that pop open, right? So I don't have one. I want to get one, but these will do sort of okay. All right, then I have some oral airways, some oral pharyngeal airways of varying sizes. And then I throw in this compartment my chest seals, because unless you can seal the chest cavity from penetrating trauma, then you really can't get good ventilations because the pressure and the equilibrium is off in the chest cavity and the lungs can't function properly. So I keep the chest seals in there. Also at the bottom of that is I keep a Mylar emergency blanket. If you go by the MARCH algorithm when you're doing your patient care, which is massive hemorrhaging, airway, MAR, respirations, C, circulation, H, hypothermia. If you have significant blood loss and your body doesn't have the ability to regulate its temperature, then you usually become hypothermic. So maintaining body temperature is important. So I got one of those in there. In this compartment is going to be my medication and some kind of other stuff. I live in an area that is prevalent for drug use, so I carry Narcan. These are my medical gloves. These are also, this is my little pill pack. So it's nothing crazy, guys. And I know as an EMT, underneath my scope of practice, I can't administer medications, right? But if it's for my family or for my buddies, I can, right? Or I will, because I wouldn't be actually functioning in my official EMT capacity. But whatever. So I have Advil. Guy sprains his ankle. I can treat his ankle. I'm like, here's some Advil. I can't give it to you, but I could hey, I have Advil. It's laying right there. And then walk away. But I can't be like, I'm an official EMT. I'm giving you this. Tons of triple antiseptic ointment, antibiotic ointment. These are antidiarrheals. And that's it. In this little pouch right here. This is actually a medical glove pouch that I just put some of the pills in there. All right, two protective eye dressing things. So if you have an eye injury, you obviously don't want to apply pressure over the eye because that can cause problems. So you want to have some sort of a rigid or semi-rigid thing to put over top of the eye, and then you dress the eye and you block both eyes. And I'm not going to teach you how to be EMTs. All right, so some generic Benadryl for allergies or whatever. This is these are just wet wipes. And then this is where I keep all of my Band-Aids. This is probably going to be, if you're going to be your team medic, then, it's important to have, the big bandaging stuff. But most of the time they're going to say, hey, doc, do you have a Band-Aid? And you can say, yes, because I'm not an idiot, and I brought Band-Aids with me, as well as my tourniquets and my Israeli bandages and all that other shit. So, and then Now, if you're getting blisters, then you need to figure out your socks and your boot situation, but somebody will be stupid enough to still get blisters. So these are the wet wipes. Okay, so that is the medication pocket. All right, next up is going to be this bottom compartment right here. And in here I have triangular bandages, or the cravats, right? These are, there's, you know, a million and one ways that you can use these things. You can use this as a part of splinting and immobilization if you have an arm or a shoulder injury. You can use those. You can use them to stabilize for splinting. I mean, it's important to have these things. You guessed it. Oh, I got two of these. All right, I'll keep two. I'll put the other one in here. I didn't realize I had two Mylar blankets in there. All right, now getting into kind of the rapid area here. So the reason why my nasal pharyngeal airways aren't in the airway compartment is because a nasal airway is going to be kind of the one that you're going to go to first when establishing an airway. So I keep the nasals on the outside, and I keep a 26 unpackaged. I know it's not sterile. I don't really care. Because a 24 to 26 to 28 size is going to be, really 24 to 26 is going to be the average size that you would use for your standard adult male. So I keep those ready to go. I don't have any smaller ones, so I'm not too worried about it. Again, I forget what size this oral is. I forget. But yeah, this is going to be one that's going to be pretty standard for an adult male. So if there's facial trauma, obviously you don't want to put a nasal pharyngeal airway if there's somebody with facial trauma, so oral is right there. Scissors, these are the little clamp things. I know there's an official name for these. I don't know. But like, I don't know, if you get a dude that, and if you're out west and a dude, you know, hit a cactus with his leg, you can use these to pull stuff. These are just really nice fine needle nose tweezers. I actually used these when I was at NTC. One of my privates got his rubber earbud stuck deep in his ear, and I had these in my gear. I don't know why, but I was able to use these to go in there and pull the freaking earbud out. So that was pretty funny. All right, so I keep those. Sharpie and a pen light. Pen light's really good for, you use this to look at the patient's pupils to see if they're dilated or constricted, or one's even, one's not even, if they're reactive to light. So you use your pen light to evaluate the patient's pupils. And then I got, you know, just some small tweezers. Always nice to have little tweezers. Tape, big roll of tape ready to go here. Yeah, that's what I carry on that panel right there. And again, that panel can come off. All right, and then in this top panel right here, this top compartment, are my ACE bandages, my ACE wraps. ACE wraps are awesome. You know, if you have an injury, you put your dressing on there, you put your gauze in, you can ACE wrap it and keep it a lot more secure. So lots of ACE wraps. And then this is just a roll of cling wrap. This is self-adhering tape, so it doesn't stick to your skin, it only sticks to itself. Again, really good for taping, you know. All right, oh, and then this is the North American Rescue Gecko Grip Tape. It's just pre-cut strips of tape that you just have to peel off the backing like a sticker, and then you can use it. So that's cool. All right, so that's the main compartment. On the back, it's a shoulder strap design. You can take the shoulder straps off if you want to like molly it into your back panel. I don't know, whatever. But it's there. But there's also this compartment right here. And in here I carry a super duper big trauma dressing for big bleeding, but mostly for abdominal wounds. So with abdominal wounds, again, I'm not teaching how to be an EMT here. You don't want to like pack like you would for penetrating wounds in your extremities or your junctions. You don't want to put anything in the abdomen. So what you do is, if you had an abdominal injury, you would just place this over top of the abdomen and then secure with whatever, tape or ace wraps or whatever. So, or if there's just a shit ton of bleeding, big abdominal trauma pad. I have another large sterile burn sheet. And then I have, oh boy. I know that this has an official name. I don't know the exact name of it, but this is like the military space blanket for patient packaging. So I have like the little cheapo thin ones, but if you needed a larger trauma blanket, then you can use this. Not a trauma blanket, Mylar blanket, then you can use this for maintaining your patient's core temperature. And yeah, that's my med bag. So thanks for watching, and more content to come. If you like it, share it with your friends. Again, I'm not an ENT, or I am an ENT, but none of this is medical advice. And if you're not properly trained on how to use anything in here, then go get that training before you attempt to do any sort of medical interventions. That's my disclaimer. None of this is advice, and that is that. So see you all later.